Look closely at this network of translucent, organic tubes. This is a highly abstract view of a secondary drainage system operating just beneath your skin. It helps your body, a complex living machine, manage its internal fluid balance. The large red pipeline represents blood vessels, handling most fluid transport. The smaller green pipeline, the lymphatic system, manages critical overflow, carrying toxins into specialized nodes. Here, cellular debris is filtered out, leaving clean fluid to safely cycle back into the bloodstream. But what happens to the surrounding tissues when this fragile secondary plumbing breaks down and that excess fluid suddenly has nowhere to go? The medical result is a condition called lymphedema. Without a working drain, tissues permanently swell with trapped fluid, typically occurring in the arms or in the legs or even the head and neck. For a patient, this means navigating life with limbs that feel incredibly heavy and stiff. The swelling physically restricts basic range of motion. The skin can blister, discolor, and leak fluid, creating a constant high risk of severe infection. So when we talk about lymphedema, we are dealing with a chronic, systemic breakdown of the body's essential waste management infrastructure. The triggers for this system failure generally fall into two categories: primary issues, which stem from internal genetic anomalies, and secondary issues, which involve external, acquired damage to the network. Hereditary or primary lymphedema is relatively rare. In specific cases like Milroy disease, a genetic flaw prevents the structural components of the lymphatic system from forming properly right from birth. As this chart shows, if we look at all hereditary cases, 80% of them are caused by a single genetic condition known as Mage disease. Secondary lymphedema is much more common. External factors like physical trauma, severe obesity, or poor pumping from heart and kidney conditions can physically crush or overwork the drainage network. One of the most frequent causes is cancer treatments, specifically mastectomies. When surgeons remove underarm lymph nodes to clear malignant tissue, the arm's primary drainage route is destroyed. The fluid pathways instantly back up, trapping the fluid. Subsequent radiation therapy can compound the problem. The radiation treatment creates thick scar tissue that inflames and further strangulates whatever surviving lymph vessels are left. Whether the flaw is written into a genetic blueprint or results from the surgical removal of key pathways, losing these biological drains creates a catastrophic structural backup. This fluid backup escalates in 4 distinct stages. It starts at stage 0, a latent phase where there are no visual changes, but the patient feels a deep, persistent achiness and tightness beneath the skin. In stage 1, or mild lymphedema, you see pitting edema. Pressing the skin leaves a temporary physical indentation in the trapped fluid. By stage 2, the swelling becomes more persistent. The fluid begins to harden, giving the underlying tissue a chronic spongy texture, while the surface skin thickens and inflames. Stage 3 is severe. The fluid retention causes dramatic limb expansion. The damaged area hardens completely, skin alterations become permanent, and patients frequently lose function in the affected limb. Doctors use lymphoscintigraphy to locate the exact point of failure. That glowing dot represents a radioactive dye injected into the patient. Medical scanners track its flow through a tree-like network until it hits a sudden dead end, mapping exactly where the internal traffic jam is occurring. Mapping the precise location of the failure gives doctors their target. It is the critical first step before they can attempt to bypass the blockage and restore internal pressure. The underlying reality of lymphedema is that there is no absolute cure. Because it is a mechanical pressure problem, it has to be aggressively managed from the outside. One common approach is manual lymphatic drainage. Therapists use a specialized, extremely light massage technique to physically shift the trapped fluid out of the swollen limb and toward working unblocked arteries. To keep that fluid moving, patients rely on multi-layer compression bandaging and tight prescription-grade elastic sleeves. These garments artificially recreate the physical pressure necessary to force stagnant fluid back into systemic circulation. This diagram illustrates a pneumatic compression device at work. Wearable pumps connect to a sleeve, and as the outer bands squeeze rhythmically from bottom to top, they mimic the body's natural internal pumping rhythm. But when external pressure fails to relieve the symptoms, Surgeons have to step in and restructure the body's lymphatic architecture. In severe cases, they perform an operation called debulking to physically strip away irreversibly damaged skin and fat. Surgeons can also perform lymph node transfers, importing healthy nodes from other parts of the body to build a brand new filtration network. Look at this schematic of a lymphatic bypass procedure. Surgeons sever a blocked lymphatic vein and splice it directly into the larger venous blood system, allowing the fluid to dodge the clogs entirely. The lymphatic system is a fragile network, easily disrupted by genetic disease or surgical trauma. Yet by understanding the physical laws of its flow, modern medicine can manipulate, compress, and physically reroute the body